Good morning and Assalamu alaikum. Today our topic will be the anatomy of the ear. I'll be just like doing it superficially, not so much deep, just so that you understand it. Okay. The ear is basically divided into three parts. One is external, then there's middle, and then there's internal. We will be studying the diseases for individually for each part. Okay, let me show you the ear. Okay, here you can see there's this from pinna to the tympanic membrane. There's external ear. Okay, then there is the middle ear containing the eustachian tube as well. Okay, then there's internal ear containing the cochlea and semicircular canals and the nerve as well, vestibular cochlear nerve. Okay, so we'll be studying them individually. Okay, so this is the part of the external ear, the pinna, which its part is to um, converge the coming sounds from everywhere. Okay, it converges and then sends them to the ear, the tympanic membrane, so that we can hear it. Okay, this is the lobule which women do piercing on, and this is the tragus. This one we press it when we want to cover our ears, and then when there is too much noise. And opposite to it, that is anti-tragus. This is the crus of the helix. This is the triangular fossa. This is the helix. This helix, and then this is the anti-helix inside. Okay, this is the Simba concha, and the this inner part is the concha. Okay, this is the cartilage, the auricular cartilage, and the same parts, not too much different. Okay, this is the external ear canal. There, here was the pinna. Okay, and then there is the tympanic membrane, the ossicles, malleus, incus, and stapes. Okay, and these are the important landmarks. The examiners ask you to make this diagram in your OSPE or paper. You should revise it, and you should know which structures are normally seen in the tympanic membrane when you are looking at from an otoscope. Okay, an otoscope is used to look inside the ear and see whether the tympanic membrane is intact or not, or is there any problem with it, the otitis media or some other problem. Okay, so we'll study the landmarks. This is the cone of light. Whenever you shine light in the on the tympanic membrane, you'll always see a cone of light. There's in this part there's only light. You'll see only light, like it's shining like a bulb. Okay, and then there's the shadow of the round window, and then there's the shadow of the eustachian tube. Okay, this is the pars tensa, meaning the dense part. It's just like a drum. The membrane is just tight like a drum. Okay, and this one is the pars flaccida. This one is the pars flaccida, meaning is flaccid, not stretched out like the pars tensa. Okay, tense means tensed, stretched. Shrapnels, pars flaccida means flaccid. Okay, this is the shadow of the incudo-stapedial joint, the joint between the incus and the stapes. Okay, I hope you got the basics now. Let's see um, the tympanic membrane. Okay, this is the pars flaccida, the flaccid part. This is the pars tensa again, and this is the annulus tympanicus surrounding all of the pars tensa. Okay. Then there is the middle ear. It is divided into three parts: the epitympanum, the mesotympanum, and the hypotympanum. Okay, this is the lateral attic wall. Attic means the ceiling or the upper part. This is the pars flaccida, and this is the pars tensa. Okay, and these are the ear ossicles: malleus, incus, and stapes. This is the footplate of stapes joining with the oval window. Okay, and this is the whole middle ear cleft. The eustachian tube, which is coming from the nose, this is the attic, means the top part, and this is the middle ear, and it is going from the adytus to the antrum, and the antrum is lying outside near the pinna, in the external ear, with the mastoid ear cells. The middle ear is like quite long. Okay, it is the mastoid ear cells are lying beneath the mastoid bone. Okay, I hope you got this as well. These parts are not much important. Okay, we now do the ossicles. This is the malleus, this is the incus, and the stapes. The important part is the footplate joining with the oval window, and this is the handle of malleus. Okay, let's see the internal ear now. This is the cochlea, the round part. Then there is the oval window after cochlea, and the stapes footplate lies here. The round window, the superior semicircular canal, the lateral semicircular canal, and the posterior semicircular canal. This is they are lying basically in the 3D. This is the 2D version, but they are in 3D. Okay, then here between the cochlea and the semicircular canals, there's the vestibule, meaning the vestibule basically means a pathway between two things. Okay, so there is lying the atricle in the saccule, which tell us in which way we are going. Okay, either we are going up down or right left. These important part is played by the atricle and the saccule. Okay, this is the section of the cochlea showing us the scala media, the scala vestibuli, and the scala tympani. Okay, this is the Reasoner membrane dividing the scala vestibuli and the scala vascularis. Okay, and this is the basilar membrane dividing the scala tympani and scala stria vascularis. Okay. Okay, let's see other things if they are important or no. Okay, this is our anatomy of the ear. Thanks for listening. Allah Hafiz.